Hi, for the interpreters, is there any channels set up?
Is this Claudel?
Yes.
Yes, I just sent you 2 new emails. If you can follow the link, please. We've been struggling with this.
Okay.
Okay.
Hello, colleagues. Good morning, good afternoon, good evening, wherever you are in the world. Just to get us oriented, for anyone that would like to use interpretation, this is accessible by clicking the globe icon at the bottom of your screen. We are having some, maybe some minor delays with interpretation, so please be patient with us. L'interprétation est accessible en cliquant sur l'icône du globe terrestre au bas de votre écran.
Buenos días, buenas tardes a todos. Se puede acceder a la interpretación haciendo clic en el icono del globo en la parte inferior de la pantalla.
And colleagues, I know we don't have everyone in the audience with us just yet, but is there anyone in the audience that would just introduce or orient our colleagues to the Arabic? Perfect. Let's open your mic. Mashouk, please come in. Yeah, Mashouk, if you're able to unmute yourself, I think you have access. It would be great to have you come in and just help orient us to the Arabic.
No, Claudel, can you hear me?
Mm. Mm. Hi, Mashouk, are you able to speak?
Yes, yes.
Great. Thank you in advance for helping orient us in Arabic.
Yes, I can hear you, Claudel. Can you hear me? Super. Great. Wonderful.
Okay. All right, then, moving right along. Next slide, please. It's great to see so many colleagues being proactive and putting your introductions in the chat. And great to see so many colleagues from so many different countries.
Apologies. I believe all the interpreters are in their booths now. I think they should be okay. I'm just going to do a quick sound check for Arabic, but I think it should be okay now.
Okay.
Thank you.
I can hear you, Rashid. Can you hear me? Super. Super. Great. Thank you. Okay, Alexa, we're all good for interpretation now. Apologies for the delay. I think everything's okay.
Great. All right, just waiting on that slide deck. Great, next slide, please.
Yeah, as we wait for the slide to come in, really appreciate, I see that we have representation from different countries. I see Somalia, I see Pakistan, I see Burkina Faso, I see Malawi. My name is Dennis Kioko. I'll be co-moderating the session with Alexa. I support the Global Cluster Coordination section in UNICEF as a localization specialist, and grateful that we are here today to discuss on resource mobilization.
Thanks, Dennis. And hi, everyone. Hello again. My name is Alexa or Alexander Humphreys. I am the GNC Interim Localization Help Desk. I say interim because I look forward to handing this position over to someone with actual experience, having worked for a local or national actor in the near future. And I'm currently based in Lisbon, Portugal. I'm honored to be joining you today. Now, we're going to do just a little bit of housekeeping before we kick off the webinar. So everyone is informed, this webinar will be recorded. We record the webinar so that we can share the recordings later with those who are not able to attend. And the recording has already started. We've already seen a lot, most of you have started, but if you have not, please introduce yourself in the chat. Let us know your name, your role, and where you're listening in from today. It's great to see sort of the geographic distribution of our audience. And then we get to know you a little bit more. We do encourage everyone to keep your mics and your cameras turned off unless you're presenting, so that we can have a smoother overall webinar experience. And if you have any questions about resource mobilization or anything related to this topic as we're going through the webinar, please don't hesitate to put your questions in the Q&A box. It's down at the bottom of the screen next to the globe icon. And throughout the webinar, we're going to try to pretty dynamically, we're trying to be responsive and respond to those questions in the Q&A box. If there are any outstanding questions we don't get to answer today, we will follow up with those questions, following the webinar. Also, if there's any IT difficulties or challenges, please just put your questions in the chat. And of course, after the webinar, we'll be sure that we share the recording and all the slides with you. Let's see, next slide, please. And before we kick things off, just wanted to start with a note of acknowledgement and appreciation. This webinar is hosted by the Global Nutrition Cluster, but we couldn't have done it without the organization in collaboration with African Relief Development Initiative, FIA Integrated Development Organization, USA's Bureau of Humanitarian Assistance, and UNICEF. And we also warmly thank our donors, without whom we would not be able to have important webinars like these. Next slide, please.
Yeah, many thanks. And in the spirit of co-moderating with Alexa, just to note that we, by the end of this session, would like to I see there are some colleagues whose hands are up. Probably maybe I can finish, then we can share. So one of the objective will provide this session will provide an overview of the humanitarian financing for nutrition in emergency landscape. So at a global landscape. Then it will also be great to hear experiences about resource mobilization from local and national actors. And then we'll also share resource mobilization opportunities. So let's all keep attentive up to the end of the session so that we can be able to achieve these three objectives. For the session agenda, if you can click next, please. For the session agenda, we will have presentation on the landscape on financing. We'll also hear experiences from two national NGOs, one in Somalia, another one in Ethiopia. And then we'll also hear insights from BHA USID, and then we'll have some Q&A. Maybe just to request from colleagues, if you can just type in the chat box, what is your one expectation by the end of this session? We'll give ourselves 1 minute to type. What is the one expectation by the end of this session? Your one expectation. Okay, I see colleagues are still, yeah, I see someone mentioning, please provide us a certificate for this workshop. It's a webinar, it's a 2-hour webinar. to have better skills on resource mobilization. So I know that we'll be going through those expectations, and we hope that we'll be able to meet some of them. Allow me to quickly invite our speaker to provide us with the opening remarks. And our speaker is my co-moderator, Alexa Humphreys. I've worked with her, I've engaged with her in different aspects. As she had earlier mentioned, she's currently co-chairing the anti-racism and localization workstream, the GNC anti-racism and localization workstream. She's very passionate on promoting anti-racist principles and shifting power to local actors through localization and decolonization. And as also she has mentioned, she's the interim localization help desk. So welcome, Alexa, over to you. Thank you.
Great. Thank you, Dennis. Thank you, and I really appreciate getting to open this event today on behalf of the Global Nutrition Cluster. The GNC has steadily contributed to localization over the years in different ways, more subtly in the beginning, with more intention today. But I'll take this opportunity just to provide two examples. First is that in almost all cases, national authorities are the co-leads of the different types of established nutrition coordination mechanisms in country, so clusters, sectors, and others, especially for the officially activated nutrition clusters. This arrangement is essential to ensuring strong leadership before, during, and after emergencies with the support of the cluster or sector coordination teams. Further, the GNC continues to advocate for subnational clusters and sectors to be led by subnational authorities or national NGO partners. The second example I'll provide is that the GNC has increasingly provided direct nutrition and emergencies technical support to local or national actors or groups of local or national actors. And later during this webinar, we're going to get to hear about the experience from African Relief Development Initiative, or RD, a national NGO in Somalia, who requested and received capacity strengthening support from the GNC in 2021. This was to strengthen their integrated management of acute malnutrition, their IMAM approach. And ultimately, this helped to increase their coverage and increased admissions of wasted children to health facilities, resulting in better treatment outcomes for the children in their area of operation. So that's one example of how we provide direct supports to help strengthen programming. When it comes to global level events, the GNC, we are very well known for hosting online events, but it is less common for the GNC to design webinars that are uniquely for you, for local and national actors. But as localization is a key strategic shift for the GNC, we hope to do more of this as we continue to adapt our systems and our ways of working to support the vision of a locally driven, locally led, and locally owned response to provide sustainable, high quality, contextual nutrition support to the populations and the families and individuals who are affected by emergencies. In April of this year, the GNC, we launched the GNC Localization Roadmap 2024-2025. This was a guiding document. It includes 42 activities aimed at fostering a more enabling environment for localization. And activity 12, specifically in this roadmap, includes GNC support for resource mobilization for local and national actors, because it's been identified as a frequent challenge. So that is part of the reason we're here today together, is because of this activity. The purpose of this webinar, which is not one standalone webinar, it's intended to be a three-part series, but we're here to provide the most relevant information for local and national actors on resource mobilization. This webinar is for you, and we look forward to your engagement today to guide us on the next topics you'd like to hear about related to resource mobilization for the next two webinars. So later during this event, we'll have a poll when we get to hear from you about important topics. So I will just wrap this up by saying thank you for being with us here today. It means a lot to us. Special thanks to our speakers for providing us with compelling examples and current opportunities and heartfelt engagement. to improve resource mobilization for local and national actors working in nutrition in emergencies.
Many thanks, Alexa. And just to note again that we have a Q&A section. So in case you have any questions, please feel free to type in the question and the answer section. I know that some of us usually share it in the chat box, but sometimes it's very hard sometimes to follow. So happy if you can be able to share your questions in the Q&A section. Colleagues, today we are joined by a diversity of speakers and panelists. And, we have representation from local and national NGOs. We'll get to hear their experiences. We have representation from the cluster, the Global Nutrition Cluster. We have representation from also the donor, that is USAID BHA. We also have representation from all the different diversity of local and national actors who have joined us today, and also different other actors who have joined us today. So without much further ado, I'd like to introduce our speakers, and we'll get to hear from our speakers. Please pay attention and take notes, because we will be interacting at the end of the session. So my first speaker to the left is Estefania Grivala. And Estefania is the GNC, the Global Nutrition Cluster Resource Mobilization and Advocacy Consultant. She has 10 years of experience managing global, regional, and country level public, private, and multi-stakeholder partnerships in humanitarian and development context across all continents. And just to mention that I have had an experience of working with her, and I would say that she's very well experienced and versed in resource mobilization, and she will be sharing her own experiences. The second from the left is Abdi Mohammed. Abdi Mohammed is the CEO of Africa Relief Development Initiative, that is ARDI in Somalia. And Abdi is an environmental activist and localization champion who was a member of the GNC Localization Task Force that developed the GNC Localization Roadmap. Also grateful to note that, the contributions of Abdi and other colleagues have really accelerated localization in the Somali context. Third from my left side is Dr. Mikias. And Mikias served as the Emergency Relief Program Director at Fire Integrated Development Organization, that is FIDO, in Ethiopia. He has humanitarian experience identifying funding opportunities, leading grants, proposals, and managing strategic partnerships. I'm also encouraged by the fact that I see a lot of local actors who have joined from Ethiopia. They're almost they're almost half. Not sure if Dr. Mikias, that was one of your mobilization skills. So many thanks for that. Moving forward swiftly, we have Jessica Howard. And Jessica Howard is the humanitarian advisor with the USAID in the Bureau of Humanitarian Assistance, that is BHA, civil society, and localization team. Some of us have been asking some questions around localization and BHA, and I'm sure she will, during her presentation, she'll mention some of these aspects. And then to my right side, far right side, we have Dina. Dina is the senior nutrition advisor with USAID Bureau for Humanitarian Assistance, BHA, nutrition team. She has worked with over 20 years in more than 7 countries in designing, managing, and implementing international nutrition program and policies in, as I've mentioned, more than 7 countries. So that is the team that we have, and they will be sharing their experiences. And it's also critical because it's also key because they will be sharing and we'll also be sharing our experiences as the audience. So I'll hand it over to Alexa. Many thanks.
Great, thank you, Dennis. Now, before we have our first presentation, we just wanted to take a moment and appreciate that there are a diversity of different local and national actors. So to learn a little bit more about our participants, if you represent a local or national actor, whether it be an organization or government agency, please let us know by writing in the chat if your organization is led by women or led by people with disabilities or refugees, Indigenous-led, any other sort of marginalized groups that are really important to the identity and focus of your organization, we would love to hear about. So we're going to continue, but if that describes your organization, please write a little something about your organization in the chat. Next slide, please. Great. And now, without further ado, I'm going to hand over to Estefania or Steffi, who's going to take us through a highly informative presentation on the nutrition in emergencies financing landscape. Over to you, Steffi.
Thank you very much, Alexa. Good morning and afternoon, dear partners. It's a great pleasure for me to join this webinar and to see many partners joining from all continents. So my presentation is going to focus on two parts. The first part will look at a brief overview of trends and gaps in nutrition in emergencies financing. And the second one will address trends, gaps, and opportunities around funding for local and national actors to provide some insights for our exchange with LNAs and also funding and other partners joining us today. Next slide, please.
Steffi, before you continue, please, can you make sure to speak slowly? This has been a request from the interpreters so that the interpretation
Of course.
is possible.
Yes,
Thank you.
Of course. All right. Next slide, please. So starting with a brief overview of needs, as we are all aware, the number of people in need of nutritional support globally has more than doubled since 2017. And while the number of people supported by the Global Nutrition Cluster has also increased since the same year, those effectively reached by the cluster still remain below 50% of the actual needs. This shortfall, as we will see in the next slides, is partially due to insufficient and inadequate financing. So looking closer at financing trends in the next slides, there is still a major gap between the funding needed and the actual resources allocated to the sector, which in 2023 declined by more than 50%, reaching only 30% of the funding requirements, which indeed increased by fivefold between 2016 and last year. Next slide, please. Yeah, now if we look at regional trends, with the exception of very few countries in the Asia Pacific and Middle East and North Africa regions, most regions remain underfunded, as we can see from the chart on the right. In terms of donors, most of the funding for nutrition in emergencies is provided by only 10 government donors, including the USA, ECHO, Germany, which provides 70% of total funding to the sector. Out of this, 2/3 of this funding is allocated to only 10 countries, which explains why most crisis-affected countries continue to be underfunded. Next slide, please. Beyond financing flows, there are significant finance quality gaps, which are summarized on the left. So most of these gaps are common to all humanitarian sectors. However, the nutrition sector is particularly affected by under-prioritization in humanitarian funding allocations as compared to other sectors. So in 2023, only about 5% of total global humanitarian aid was allocated to the sector, which is minimal if we compare to the almost 40% mobilized by the food security and the health sectors. Last, the nutrition sector is also affected by the very limited funding allocated to local and national actors, which in 2022 remained at less than 1.2 million of total global humanitarian funding, which is far below the 25% grant per grade target, as we will see in the next segment of the presentation. Now, to address these gaps, in the next slide, we have an overview of some of the key enablers to enhance the nutrition in emergencies financing environment, which cannot be achieved without substantially and urgently increasing direct funding for local and national actors, as we can see in the next slide. Now, unfortunately, in most crisis-affected countries, we're still far from achieving the required progress for humanitarian action to be truly locally led. As we can see in the next slide, despite progress on some of the groundbreaking localization commitments, this is not translated into substantial increase in LNA's direct access to international financing, as we can see in the next slide. And last but not least, and this is an important trend, while there is no comprehensive data on all the funding provided to local and national actors, there are some reports that suggest that a great part of the quality funding channeled to smaller international, but also local and national actors is not channeled with the same degree of flexibility as is received by international partners. So this shows that the benefits of quality funding, which has increased slightly in the past 2 years, is not reaching LNAs equally, as we can see in the next slide. So in the next slide, we also have an overview of funding to LNAs trends in the 2017-2022 period, which show they continue to receive minimal direct funding from donors, just about 2.2% if we combine both direct and indirect funding allocated to LNAs, which represents a difference of almost 40,000% as compared to funding that is provided to international actors, which continue to receive most of the humanitarian and development funding globally, as we can see in the next slide. Next slide, please. Yes, thank you. So if we look at regional trends, despite some countries in Europe and MENA regions having received up to 19% of total global humanitarian funding in some years, notably during the COVID-19 pandemic, in most regions, LNAs continue to receive a very small share of global humanitarian aid. Now, why is this happening? Most of us joining this webinar know, but we'd like to hear from partners, local and national partners joining us today. What are the specific challenges that you're facing when accessing new funding opportunities or engaging in broader resource mobilization? So we're going to launch a Mentimeter in a couple of seconds, and we'd like to hear from partners as to their biggest challenges and bottlenecks that you face and you'd like to share with us. So the Mentimeter will open shortly, and feel most welcome to share in 1 or 2 words what type of issues you're facing, what are the biggest maybe nightmares that you face every time you try to access funding opportunities with international partners. So we're gonna open the Mentimeter very shortly, and here is actually just an overview of some of those barriers and challenges which have been largely documented in many reports. So we don't need to go over each of them. We rather want to hear from local and national partners who are joining us today. Next slide, please. So we will open the Mentimeter shortly, and here is also the question that is of which we would like to hear from all of you in French and Spanish. So as we launch the Mentimeter, I'm going to share maybe in the 2 languages. Donc en français, quels ont été vos plus grands défis dans la mobilisation des ressources pour vos activités de nutrición en situación d'urgence? Y en español, ¿cuáles han sido sus mayores desafíos a la hora de movilizar recursos para sus actividades y programas de nutrición en emergencias? So we'd like to welcome partners to share their feedback. The Mentimeter is going to open shortly, and I think it's being shared on the chat. Great. So we shared the details on the chat. So we'd like to invite particularly local and national partners from the nutrition sector, but also maybe other sectors who are joining us today to access the Mentimeter with the code that has been provided and share with us your feedback. If you are unable to access the Mentimeter, you can also share your feedback on the chat box.
Please let us know if you're having trouble accessing the Mentimeter. I am sharing my screen now, which shows that we don't have any results yet coming in. But you can see we will have the results here.
So the code has been shared on the chat box as well.
Yes, it has. Okay, I'm going to stop sharing my screen because this doesn't seem to be showing anything. A few have already submitted. So is everyone able to get into it all right? I shared the link. I'm going to share it again. The link and the code. Hang on. Oh, hang on. The link is here. And then there was also the, Etel, would you mind sharing your screen again? Because there's something it's not coming up with the results. But there's the code as well. And then Etel, if you're able to share your screen again, then you'll be able to see the QR code if you prefer to get in that way.
Can you see the screen?
Yes, we can.
Yes.
Okay, I'm gonna share my screen again as the results are coming in. Hang on just 1 second.
Great. And I'm also seeing that some partners have already shared as well through the chat box, and that's okay if you're unable to access Mentimeter. It's great to see that we have some challenges that seem to be common to some partners, and we're going to get back to some of them as we move forward with the presentation and the webinar.
Okay, are you able to see the results that are coming in on my screen?
Yes.
Okay, super.
I just need to look a bit closer.
There we go. Is that better?
Yes, perfect.
Super.
Yes, thank you. Thank you very much, Andy and Etel, and thank you very much to all our partners who have shared their feedback and as to challenges and bottlenecks. So lack of information about donors who are investing in nutrition in emergency, that's one of some of the common challenges that we face. Due diligence issues, as well, limited donors to approach and high donors fatigue, security, the heaviest of processes of fund disponibility, lack of funds, lack of skills of local NGOs. And unable to see, like in the upper
Here we go.
side.
There we go.
Oh, great. For us, it's donor stringent requirements from local and national NGOs, the availability of resources, lack of capacity in resource mobilization. Localization was taken seriously by most donors, fund access to nutrition and logistical transportations. So it's great to see that most partners I feel have shared their challenges and the bottlenecks that they face. The good news is that some of these challenges can be overcome. So when it comes, for example, to more information on donors, this is where there are many tools and resources available today, particularly with government donors, because most of their policies, strategies, and funding programs are available online. And this is also where the GNC can support with providing some data and some tools that can hopefully support partners. So we're gonna get back to some of the challenges that you're facing as we move through the presentation. And also we will consider this as we define the next focus areas for the upcoming webinars. So because not everything is bad news, now that we have heard about challenges and difficulties faced by local and national partners, we'd like to share now a very brief overview of some emerging initiatives and approaches that are driving progress and hopefully will provide with some opportunities to tackle some of the barriers and challenges that have been shared today. So I'm going to ask Etel to share with us the presentation again, and where we have this overview of the new emerging initiatives that are being led by local and national actors to try to address some of the challenges and bottlenecks to increasing direct funding to local and national actors. Etel, if you can reshare the presentation, that could be great, as I'd like to share with partners some background on some of these initiatives. I still don't see the presentation.
Etel, are you struggling to share your screen?
Yes, it's a bit slow. I think it's coming.
No
Okay,
problem.
super.
So we'll wait, but maybe I will start telling you a little bit of what those initiatives are. We will share the presentation with you, so we won't go through each of them right now, but there are two sets of major opportunities that are directly linked to direct funding to LNAs and that have huge potential to drive substantial progress towards increasing funding to LNAs. So this is the first set of initiatives, but I want to focus on the second set, which is in this slide. So the first set of initiatives is around the targeted support programs that some international actors have started to roll out to directly support local and national actors to access international funding. One such initiative is the Empower Project, led by CRS, an international NGO, which has directly supported LNAs from Latin America to submit funding proposals and access multi-million funding from international donors. Given this great success, this project is currently being expanded to other continents. And the second, and maybe the most promising set of initiatives are related to the multi-donor and other pooled funding mechanisms, enabling LNAs access to international funding, which have been emerging and expanding in the last couple of years, including those that are presented here in the next slide. This brings us to the last and most important part of this webinar, of the segment of this webinar, which are opportunities, which are summarized in the next slide. So there are many opportunities. Well, there are many challenges. There are also many opportunities. But today, we would like to focus on four, which we think are critical for LNAs to unlock funding for their nutrition and in emergencies programs. So if we can move to the next slide. The next slide, please. I think it's a bit slow.
Yes. It's a bit slow.
Okay, can we move to slides? Yeah, it seems that the connection is a bit slow. Are you able to move the slides, Etel?
Yes, it's not moving. Maybe Dennis, maybe try from your slide.
Yes, now it's showing the initiatives and approaches slide still. Okay, so I think Dennis is going to try to share as well his screen. So this, yeah, This one, great. So here's the overview of 4 key windows of opportunities we think are critical for LNAs to unlock financing for their nutrition in emergency programs. So the first one is around the new pool funds and other innovative funding mechanisms we've just shared, which offer great opportunities for LNAs, as some of these funds offer more flexible funding, and some of them are actually exclusively addressed at local and national actors. This represents not only an opportunity for LNAs to mobilize additional funding that is more flexible, but also an opportunity for both local and international actors to partner and pool resources together around the establishment and scale up of these more flexible funding instruments. The second window of opportunity, and we can move to the next slide, focuses on strengthening engagement and partnerships with government donors, both bilateral and multilateral donors, who prioritize nutrition in emergencies in their humanitarian and wider development financing policies. As we can see from the chart on the right, while many donors have not made the 25% grant per grant target, some have substantially increased the volume of their funding to country-level partners. The third funding stream, which is...
Steffi, apologies, you have about 30 seconds left for your presentation.
Yes,
Thanks.
so we're finishing soon. So the third potential funding stream are pool funds, which is summarized in the next slide, which have substantially increased their funding to local and national partners. And just to mention an example, between 2016 and 2020, country-based pool funding allocations to local and national NGOs were indeed 10 times higher than the total global funding allocated to national NGOs. The last and most important forward-looking opportunity is around leveraging private funding from grant-making foundations, businesses, and the wider private sector. And here is a very important funding stream, because most private funding is actually allocated to NGOs, not to multilateral organizations, as opposed to government funding. The other important trend is that most of private funding is allocated as flexible or semi-flexible funding. And finally, just when we want to share an overview of some upcoming funding calls, particularly with government donors, but also pool funding mechanisms that we have shared. We have included links where you can access more information as to requirements and processes, and we hope that this is helpful as you seek to leverage new funding opportunities. So on this note, I'd like to finalize my presentation, and I hand over back to you, Dennis, to take us to the next segments of the webinar. Thank you.
Many thanks, and many thanks, Steffi, for that wonderful presentation. To the audience, just to note that we'll be able to also share some of those links and the opportunities on in the chat box, and also after this call. Many thanks again, Steffi, for really describing, of course, some of the bit of challenges, but also some of the great opportunities that are there. The expansion of the UN partner portal, the pooled fund mechanisms, organizations that are moving from risk transfer to risk sharing, and also the great presentations. Because of time, colleagues, I'll invite Abdi to move on with the next presentation. Many thanks. Over to you, Abdi. Abdi, are you there? Abdi, can you hear me? Okay, colleagues, as we wait for Abdi, I'll request that we invite Dr. Mikias, who, as I had mentioned, works with the Fire Integrated Development Organization to make his presentation. Many thanks. Welcome, Dr. Mikias.
Thank you, Dennis.
I'll move very quickly to the section of your presentation.
Thank you. Okay.
Thank you.
Thank you, colleagues all around the world. I will share our experience as an organization, and I will I will start with the introduction that we work and how we mobilize funds, and as part of experience sharing on the resource mobilization. Next slide. And I will also, okay. So FIA Integrated Development Organization is a national NGO. We are based in Ethiopia. We have solid 22 years experiences of in development assistance and 7 years of experience in humanitarian wing. So we started with the development wing by HIV program. Then we continued with different infectious disease program like malaria and HIV. Then we have also experience in the livelihood program. Then with the surge of acute crisis and shrinking of the funds in the development assistance, this humanitarian wing established. We started with 2 sectors. Currently, we are scaled up to 6 sectors. So nutrition is one of which. Next slide. So thus far, we have implemented 49 programs and we have around 14 active projects. And this is the staffing looks like in current annual budget of 6 million USD. And we have targeted around 250,000 population for the current year. So to give you a highlight on the geographic coverage, most of it we have been on all region practical experiences. And the blue ones are our past experiences. Next. So these are the partner organization with whom FIDO is currently in the past we have been working on. So our donors like USAID, pooled funds like EHF is our main donors. And we have also UN agencies, international NGOs and foundations in the past. Next. So for the resource mobilization, as we already mentioned by Steffi on the trends, the trend of humanitarian funding, this is taken from the financial tracking system from the pooled fund. As you see in the 2024, the total amount of funding is much shrinked. Next. So how do we mobilize funds as an organization? Is we follow grant applications or waiting for call for proposal. These are both competitive and non-competitive. For the competitive, we compete with other partners. And for the non-competitive, directly the donors or the partners with funding approached us to apply for funding. The other is we go for direct applications for the donors like USAID and EHF. Also, we go as a sub-implementing partner in some of our applications. So as other types of revenue streams, we do have a strategy plan that is focused on giving this income generating activity that is now possible in our country. So in the process of applying for funding, the major issue we identify that help national NGO are active participation in the coordination platform, mainly in the cluster system, both at national and regional levels. Also participation in the decision-making structure, like strategic advisory group, also in the leadership, like technical working groups. As Stephanie mentioned, we have to proactively look for funding opportunities in the websites, also follow up on the humanitarian program cycle. Also directly approaching partners like INGOs, UN agencies for partnership, also with the other national NGOs, INGOs for consortium formation for capacity sharing. So the main thing is we have to also hear the community and we have to strengthen our institutional capacity to meet the donor requirements in policies and procedures. Then on the proposal development, we have to make sure to show the how part, that is what the donors or partners are looking for. So we have to show that part. Next slide. So the main challenges we faced are the multiple crises, and also the funding is also reduced. And this localization is also largely exercised by main donors like USAID, AHF in our context, and they don't, some are not fully exercised this locally led actions unless it's mandatory in the application. So the overhead cost is also not being shared with the national NGOs. That is also the challenge that is meant to be to build our capacities, but some considers to use it for direct costs or admin costs. So we will not have an opportunity to build our capacity as it meant to be. The next are the challenges in terms of capacities, like in multiple grant management, coordination capacities, and to show our work for larger audience or humanitarian communities. And the coordination way we operate are in the lower system in this platform as at the higher level at the national and subnational. So the representation of national NGOs in this platform is lower, so that we cannot hear of the funding opportunities, the partnership, and others. The next. So the recommendation we put forward is one is our participation in these coordination platforms in being able to represent on the technical working groups and others. And when we design program, we need to focus on the communities. We need to assess the needs, and we meaningfully engage the community. That is what the donor want to hear, and meaningfully implement impactful projects. So as an organization, we have to build strong internal control systems, and we have to build institutional capacities, and compliance to the donor as well as to the community is also essential. And whenever we found an opportunity, we have to advocate on the challenges we face on the policy levels that national NGOs are facing, and operability at every opportunities. So these are the presentation from my end. Thank you. Over to you.
Thank you so much, Dr. Macias, for sharing your experience, the experience of your organization. Something that really stood out to me as you were speaking is, you highlighted the importance of institutional capacity strengthening. We oftentimes focus on the NI technical, which is very important, but oftentimes the institutional is also key to be able to deliver quality programming, but also to mobilize the funds for that programming. So now apologies colleagues, we're kind of switching things up a little bit. We're now going to go back to the presentation for Ardi. So Abdi, over to you.
Thank you very much for having me. It's a great pleasure for me to be here today to attend this webinar. I would like to start first with the introduction, and after that just talk about the experience in terms of localization, and discuss about challenges and opportunities. African Relief Development Initiative is a minority marginalized community-led organization based in Lower Juba, Somalia. Established by minority community professionals in Somalia due to the devastating and concurrent droughts in Somalia in 2013. From 2013 to 2017, we have been advocating for inclusion for marginalized communities and minorities in Somalia program from UNICEF to December, amount 49,900. RD is we have been targeting malnourished children. We have asked support we have reached 3,000. Through this support, we have received we have reached 3,000 malnourished children. During this time, there has been massive displacement in Somalia, and after 3 months, we could not continue the program. Because we have received high admissions, and we have also received 3,000 more children. UNICEF has given us supplies, but we have got funding from Somali diaspora during this time. Next, please. Some of the challenges we have faced during this time. We have asked support for many organizations, but we have received support from GNC through our integrated management of malnutrition. We have built the capacity of our staff, and during that time, through this support, we have achieved to reach many children. We have also managed to train 100 community volunteers who are now using the skills they have learned. Some of the challenges we are facing today is there were the due diligence issues, which is a burden to local organizations, which is a big burden. We need to reduce that. Mobilization of networks and also preparation to have funding gap, that was a big gap. Lack of training or resources mobilization. Localization is seen as a theoretical, not practical. There are no tangible results for localization up to now. We don't have, most of the local organizations don't have local resource mobilization specialists. This is also, a gap. There's also, there's also a burden for donors, local also fluctuation of donors. Also, there's also a challenge with donor preference. Some of the donors, they prefer alliances. Next. So there are a lot of opportunities. We have Edge Funders Alliance, we have Start Network, we have TechSoup, we have NEA Network. There are also a lot of platforms popping up. We have also the GNC localization. Truly speaking, the local NGOs have a big challenge. Until we address these challenges, things we have a long way to go. Thank you very much.
Thank you. Thank you, Abdi. And many thanks also for sharing some of these opportunities. I see Edge Fund Alliance, Start Network, TechSoup, NEA Network, and also there are also other platforms that are popping up, and there are also the GNC localization. Colleagues, because of again of time, I'll be happy if you can also just type in one interesting thing that you've learned from Abdi presentation, and then I'm happy to hand over the program to the mic to Dina and Jessica from USAID BHA. Many thanks.
Thank you so much. And I know as our slides are getting pulled up, just want to share my appreciation. I'm Jessica Howard. I'm part of the Civil Society and Localization team within the Bureau for Humanitarian Assistance, and wanted to really acknowledge and appreciate all of the information and questions that the audience has shared in the chat, as well as in the Q&A. I think it's so important on the donor side to hear more about your challenges and to think through some solutions together. And then, of course, Dr. Macias and Abdi shared some really valuable recommendations for this group as well. So just wanted to really appreciate this opportunity. Maybe we can go to the next slide. Wanted to start, I recognize there may be a bit of a delay with some of the slides, but wanted to start with a definition of localization that we're using within USAID. And I share this because we know localization means different things to different people. And it was a big topic of conversation internally. What are we even talking about? And so USAID defines localization as the set of internal reforms, actions, and behavior changes that we are undertaking to ensure that our work puts local actors in the lead, strengthens local systems, and is responsive to local communities. So a couple things I want to point out about this definition. One, localization is a change process for us. So it's not the end goal, it's a process. The end goal for us, for BHA, is locally led humanitarian assistance. That's what we're working towards. As you'll note, the definition also is not all about funding. Resources are a really critical piece. But as we think about our internal change process, we're thinking about all of the different shifts that need to happen to more effectively center local and national organizations and communities. Next slide, please. So as I noted, the end goal for us is locally led humanitarian assistance. This is a term that we're using quite a bit. And if we could go back to the previous version of the slide, I want to show that the vision, thank you, for on the screen, because we went through a multi-year consultative process to develop the shared vision for locally led humanitarian assistance as a donor. And some of you may even have weighed in on the consultations or in our external comment period. But this is where we landed with the vision. So it's where USAID places local communities at the center of our humanitarian work and we support a humanitarian system that operates on the basis of local decisions and priorities and reflects the needs and preferences of all affected groups. So this is our vision. I can't say that we've fully realized it yet, but going through a backwards mapping approach, we established this vision, and then we were thinking about, okay, what are the key prerequisites to achieving this vision? And that's what you see here on the left of the screen, though the text may be a bit small, but I want to touch briefly on these 5 different prerequisites for achieving the vision. The first is accessible funding. I think this is familiar to all of us. So this includes direct funding, but also looks at the quality of funding from the donor perspective. Is our funding flexible? Is it multi-year? And then when we think about indirect funding, so where there may be multiple levels of partnership, are we supporting equitable sub-award relationships? That's really a critical piece for us. The second prerequisite is having sufficient internal capacity to support local partnerships. And this means having trained staff with the bandwidth to manage local awards and having sufficient technical guidance and resources to set our colleagues and partners up for success. We talk a lot about, I think in this space, we talk a lot about partner capacity, which is critical, but I think we don't always talk enough about donor capacity and how we need to do our own capacity strengthening to make sure that this is a system that we are prepared to support internally. Our third is that partner capacity piece, but expands it to include mutual learning. So looking beyond defining capacity from the donor perspective as strictly the ability of an organization to achieve funding, and more explicitly recognize that you are the experts in your context. You bring your own critical assets to the table. And so starting from that should be our starting place when we talk about capacity strengthening. What assets are already in place? How can we leverage the expertise you bring to the table? And then if there are any gaps that we feel we've identified mutually, how can we bring resourcing to that? The fourth prerequisite is around local humanitarian leadership. So this refers to all of the ways that we can structure our partnerships to put local actors in the lead, in the driver's seat. So this means through earlier and more meaningful engagement in program design, leading on activity implementation, and then taking on leading roles in evaluation and research activities, which should be based not on sort of Washington, D.C. based questions of interest, but should be based on locally determined definitions of success when we think about evaluating the effectiveness of some of our interventions. And then the fifth is around humanitarian diplomacy and policy leadership. So the Bureau for Humanitarian Assistance within USAID, within the US government, we are one of the largest donors in this space. And it's important that we use that influence responsibly. So how can we influence other donors? How can we advocate for coordinated changes, especially when it comes to changes I think we'd all like to see when it comes to engagement around UN agencies? And then perhaps most importantly, how can we lead by example? You see, we have the shared vision where this is all the foundation for a new policy on locally led humanitarian assistance. I think if you switch to the next slide, please, you'll have kind of a sneak peek of the front page of this forthcoming policy on locally led humanitarian assistance. Currently in the final stages of clearance, we hope to launch this later this year. But this really outlines how we define and are moving towards the shared commitment to locally led humanitarian assistance. And we will certainly keep the nutrition cluster in the loop when it comes to engaging around the policy when it's launched. And there'll certainly be opportunities to hear more from us. We want to hear more from you. But this is sort of the foundation, the overall structure for our approach to advancing locally led humanitarian assistance. Next slide, please. As we think about kind of putting these commitments into practice, this is the hard part, right? It's easy to make commitments, but then thinking about how do they actually translate to the work on the ground? At the agency level, we have 2 key indicators that we're using to assess localization progress. One is around direct funding to local actors. It's a quantitative indicator. And the second is around the extent to which our programming incorporates good practices in local leadership. So that's a qualitative indicator. And we've just released a new agency localization progress report that really dives into the most recent facts and figures. So I'm going to actually put that link into the chat if folks are interested in digging into where we are when it comes to those indicators. But we know that when we make these commitments, they must also be paired with concrete actions to become a better partner to local actors. And so listed here on the slide are some of the changes that are already underway in service of becoming a better partner. So we've introduced a number of new flexibilities and resources to support partners of all kinds, but I think we, with an eye to really bringing on more local partners. So we are expanding opportunities to release solicitations and accept applications in languages other than English. We are looking at streamlining some of our award processes and guidance for certain types of awards. And then effective later this year, we are increasing the de minimis rate, so the standard indirect cost rate for both partners and sub-awardees, so our partners, to 15%. So for those who do not have a separate negotiated rate, this is the standard rate that is allowable in terms of cost recovery. And this change is in a response to requests from local partners or for partners of all kinds. We're also looking at ways to reduce other persistent barriers to partnership, which I think have been highlighted really well in this conversation over the last hour. But we're looking at diversifying a number of our award mechanisms, so including agreements that allow for more simplified due diligence processes. I saw in the Q&A box there were some questions about, well, all donors have these different requirements. How is one organization supposed to respond to all of these different requirements? And so certainly with an understanding of that complexity, we're thinking about where we can simplify and streamline internally. And then we're looking at improving training and doing more proactive outreach to interested organizations and partners. So it's not all about you have to figure out how to come to us, but us doing more sort of out in the community outreach to think about how we can work more effectively together. We're also expanding our capacity strengthening approaches. So capacity strengthening is an element of many of our awards. But we also have a number of programs dedicated specifically to building local humanitarian leadership opportunities and local partner capacity to engage in humanitarian coordination structures. Next slide, please. And with this, I'm going to turn it over to my colleague, Dina. Over to you.
Thanks so much, Jessica. And thanks again for having us at this event. We're very excited to be here. Just to kind of quickly touch on a few nutrition-specific areas in which BHA provides support more locally. And I know Jessica in a second will go through a bit more of the how to work with BHA, but these are just some examples in how we are currently supporting kind of the localization agenda. So currently we, as BHA, provide a lot of support around local and regional procurement of the specialized nutritious foods. So whether that's actually providing funding to procure the SNFs, the RUSF, RUTF, those products at the local level, or even supporting these local producers producing them themselves. There's a couple of different ways in which we support this first agenda point. That is something that BHA is incredibly supportive on. In fact, we prefer and encourage to procure at the local or regional level as much as possible. The second area is we as BHA provide a lot of support to the Global Nutrition Cluster Anti-Racism and Localization Working Group, the working group that's bringing you this webinar today. It's a work stream or working group that we really feel is helpful in engaging our local and national actors more in the nutrition in emergency work, or the NIE work. The third area is around supporting the consortium, or what we would call the sub-awardee approach, to help build the local national actors or local NGOs to build their capacity. So what this kind of looks like is, while we provide, let's say, a direct award to your Save the Children's, your ACFs, your World Visions, they will then provide a sub-award to local actors. And this is mainly because, to be quite honest, even though Jessica mentioned that we're trying to improve the way that we work with our partners, it can be really cumbersome for a lot of local actors to work within the USAID or BHA system. So this kind of approach helps take some of the difficultness in partnering with BHA and putting that more on the larger INGOs, whereas the local NGOs are able to kind of actually implement some of the work. So this is a great approach to help build the capacity and the interaction with the USAID and BHA, particularly in emergencies. The fourth area is really trying to provide local positions within the National Nutrition Cluster. This is something that we as BHA have done continuously and will continue to do, because we feel that having strong coordination that's locally led is invaluable. And lastly, but this is not an exclusive list, because there's many other areas in which we support. We do provide a lot of support within kind of the country emergency response funding, so the SURF, in many of our countries. And so that actually does provide direct funding support to some of the local actors that are able to apply for this. So I'm going to hand it back over to Jessica to kind of go over how to actually apply for BHA resources and what that looks like. Over.
Thanks, Dina. And I know we are getting close on time, and so I'm glad that we'll be sharing these slides out with everyone afterwards, so you can sort of dig into the details. But I did want to very quickly sort of highlight the general process for working directly with BHA. So first of all, the first step is always to engage with BHA staff at the country or regional level. And this is really critical for understanding resource opportunities and making sure that there is alignment of priorities and activities. I'm going to put a link into the chat to BHA's regional contacts. So these would be the first folks that you would reach out to for a conversation about partnership. If you are in a country with no BHA in-country representation, or you are interested in a global award in multiple countries, then you would reach out to BHA headquarters, and you can find contact information on the same link. It will be really critical to familiarize yourself with our emergency application guidelines. So these are the technical requirements that we've put out for all partners. And there's information and templates and guidance for NGOs on non-competitive funding, including in multiple languages. So this is available in English, Spanish, French, and Arabic. Want to acknowledge, when you open some of this information, the guidelines can be quite complex. And so when we talk about streamlining and simplifying, we're talking about the guidelines. And so you may see some evolution in those requirements over the next couple of years as we try to pare down and make those more accessible. You will want to make sure that you're registered in our application system, and as well as in the US government's award management system, which is sam.gov. On the next slide, I'll have a resource for how you can find out more about registering those systems. If partnership moves forward, then there will be some due diligence processes, and this could be, depending on the application or the award mechanism, these could be a detailed pre-award survey process, or it could be a more simplified eligibility checklist. So it really depends on the structure of the partnership, but you could expect a due diligence step. And then perhaps most importantly is continuing to collaborate with BHA team as you finalize the work that's planned and you think about implementation together. And then, of course, working and engaging directly with the National Nutrition Cluster will be an important way to ensure alignment of priorities and thinking about how to use resources most effectively. In the interest of time, let's move on to the next slide. As our final slide. I want to share some additional resources with you all. So the first is a general USAID, how to work with USAID.gov websites. This is not specific to BHA, but does provide general information for all of our partners, including how to register in those systems. And I'll put that link into the chat just for ease of access. And then we do have a separate partner with BHA webpage, and this links to those regional contacts. This links to the emergency application guidelines, so you can find some more specific humanitarian focused partnership resources on that webpage. And then we have a number of webinars coming up later this summer on how to work with USAID, and there's a specific session on how to work with BHA. And so the details, the dates, the times for those webinars are still coming together, and we will absolutely share those details with the nutrition cluster and the organizers of this session to make sure that that information is shared. But wanted to highlight that there will be some forthcoming opportunities to hear directly from some of our contracting folks on how to work with us directly. And then, of course, please reach out to my team, the Civil Society and Localization team. You can see our email here at the bottom of the slide on how to, if you have ideas or thoughts or challenges you'd like to share on localization and how we can work more effectively together. So for applications and funding, certainly reach out to your regional contacts, which we've linked in the chat. But for broader conversations, always happy to hear from you on our team. So I'll stop there and look forward to any questions you may have. Thank you.
Great. Thank you so much, Jessica and Dina, for taking us through that presentation. Fascinating, full of good insights. I know there is never enough time on these webinars. There's always so much we want to share, but something that really stood out to me, I appreciated how you said localization is a process. It's not the end goal. Our end goals are much bigger, actually, but it is a sort of a guiding process. As with the other presentations, we definitely welcome for those in the audience. If you have a key takeaway from the BHA presentation, please put that in the chat. We'd love to hear what were some things that stood out to you. And now actually we are going to have a poll, but if we can bring the slides back up. I had mentioned actually during opening remarks that we would be checking in with our participants, everyone here today, and asking about what are the future. We want to have 2 more webinars relevant to resource mobilization. We would love to hear about what are 2 other topics you would like to have webinars around or things you would like to learn about. So again, we're going to ask you to go to menti.com or mentimeter.com. I believe we're sharing the code in the chat.
It's in the chat.
Wonderful. Thanks so much, Andy. And when you open that in menti.com, you're going to see that there are a number of different topics. There is a topic around building funding proposals. There's a potential topic around preparing quality donor reports. Maybe you'd like us to have one of the next webinars be around advocacy. Perhaps you would like to learn about digital and non-digital communications and visibility. We could have a webinar that focuses on donor requirements. We saw that come up several times in comments today. We could have a webinar which really focuses on registering and use of the UN Partner Portal. We could have a topic on capacity sharing and mentoring for resourcing. And then if there's another topic that is not covered within those, those categories that we've put into the Menti, please feel free to just put them directly in the chat. We're going to be going back through and looking at all of your comments. We have it here on the screen as well. We have the Menti and the code. And that prompt question is, just asking them if we're going to have 2 more webinars. Pick and definitely this is really focused on local and national actors. So we really encourage, if you represent a local or national organization or government agency, please weigh into this poll. It's going to help inform the next 2 webinars. But if you can select the #1 topic you're most interested in, we're actually going to watch, pause for a moment and see what you're thinking and feeling, what you're most drawn to, what you think would be most relevant for your organization. So please weigh in. I see we have about 8 individuals. And I see also some comments in the chat. Oh, someone said, beautiful presentation. Thank you. We appreciate that. Donor priorities is something someone wrote in the chat. Also seeing advocacy kind of reinforced in the chat as well. Within the chart itself, so far, please, anyone else that can weigh in on this. I know there are a number of us on the webinar today, so please go to the Menti if you can. Just to make sure, I do apologize because within the Menti, it's in English. So I'm going to put into the chat those topics all in French, Spanish. Let's see if I can do that. Let's see. Yeah, it does not. Some reason the chat is having some challenges on my side. But in any case, definitely seeing, oh, this is so interesting. In the chat, we're seeing a lot of building funding proposals and donor requirements. In the Menti itself, strongly building funding proposals. And then advocacy is also highlighted. And there's also a number of individuals who are weighing in on that it would be useful to learn about registering and use of the UN partner portal or UNPP. Thank you, Andy. Again, apologies. The Menti limitation is not having enough space to put all the languages. So for Spanish, French, and Arabic, Andy has put the translations for each of the categories in the Menti into the chat. So if that is helpful for your reference. And in the interest of time, I'm actually going to, let's keep, Andy, if we can keep this on the screen, it can keep populating. But I know we are so short on time, but there was, we wanted to have at least one question that was answered. So Dr. Macias, I'm going to call on you to answer a question if that's okay. There was a question, Sadiq Hirsi had asked, how has FIDO adapted its strategies to align with donor expectations and funding trends? And I was wondering, Dr. Macias, if you would be willing to come in and answer that really good question.
Yeah, thank you. That is the main challenge being mentioned as a barrier, and also it's important to note that. So we should align the priorities, especially with the donors with the funding trend. The main thing is for the main reason for this is scarce resources. We have been talking about shrinking of funds. So this scarce resource will be allocated based on need. So this is prioritized through the cluster system, aligning with the national priorities. So one thing to make note is we should follow such information by participating in the coordination structures. And given the opportunities of localization, there is so much opportunities out there. And there are technical assistances that's being offered by international NGOs, UN agencies, and even big donors like USAIDs. In this cluster system, global nutrition cluster is also providing these technical supporters. So we have to reach out for that and participating in capacity strengthening projects so that we align these priorities. And also we can also work for technical assistance like building these procedures, policies that aligns with major donors based on in our contexts, so that you can establish these policies, procedures with that of to the major donors, so it won't be as a barrier. Thank you, Alexa. Over to you.
Thank you, Dr. Macias. I'm sure there's so much more that could be said on that topic, and I'm apologies, colleagues. I wish we had more time for this Q&A, but we had a very full webinar today. So if it's okay, Andy, we can stop sharing this Menti, but please, colleagues, if you haven't kind of voted, please do. We're still going to look at the end results to inform the upcoming webinars. If we can have the slides be brought up until the closing remarks slide. And then Abdi, I'm going to welcome you to come provide some closing remarks and your reflections on the day. So that we can finish this event on a strong note. So Abdi, if your internet connection is good, please come in and provide these remarks.
Alexa, I'm not seeing Abdi on it. Yeah, he is on. Okay.
Abdi, are you able to speak? Yeah. Abdi, I was going to suggest if there's some internet challenges, your voice and your words are more important than your video, so don't worry about the video. But let us know if you're able to speak. If not, we might wrap this up a little faster. Okay. Sorry, Abdi. I know everyone here has dealt with internet issues and we can all empathize. Next slide and over to you, Dennis. Actually, I'll say one more thing before I hand over to you, Dennis. Really quickly, thank you again to the GNC for hosting this webinar today. If any of you would like any nutrition and emergencies technical support, you can always reach us. Please go through our website and the request support button. It takes less than 5 minutes to fill out a request. It'll go directly to our team and we can see how to best support you, whether it's a quick question or it's some more in-depth support. Next slide, please.
Many
And
thanks.
over to you, Dennis. Thanks.
Many thanks, Alexa. Many thanks to the speakers. Many thanks to the interpreters. Many thanks to the participants, to the local and national actors who have joined us today, and also to the organizers of this session. We'll stop there for today, and really thank you once again for joining and also sharing the respective inputs. And just to also to assure you that for the questions that we've not been able to respond, we will respond to those questions as we'll be sending out a follow-up email together with the recording for the session. Many thanks and wishing you a fruitful day ahead. Thank you.
Next slide. All right, I recognize we are at the hour. Thank you so much. When you leave us today, there's going to be an evaluation for this webinar that pops up. It is very easy to complete. Please weigh in, tell us how we did, tell us how we can improve. And thanks, everyone.
Thank you.